Hello everyone, you are all welcome to lecture number 1279, and today's topic is dystonia, its causes, symptoms and treatment. The word dystonia is not very common and people may not be knowing by name, but after seeing the symptoms in the body posture they will understand. Actually, dystonia means it is the twisting of the muscle movement, that is contraction and relaxation. So your muscles, once they are contracted, and automatically it has to be relaxed. So that situation is governed by information by neuron cells. So it is actually neurodegenerative disease where your body neuron cells, they are not known as neurogenerative cells, they keep on passing the information for muscles, for all part of the body, when and where voluntary to be relaxed, to contract, to expand, all these functions. So some latest research publications, they are indicating that there is one part in our brain that is called basal ganglion, and that basal ganglion portion is the center of that brain neuron cells which are processing the information and passing, and sometimes that information is not reaching there, rather than it is either damaged or destroyed, and that is causing the this type of dystonia condition, and it can be to any part, to neck, to hand, to leg, and if it is in chronic condition, it can spread to whole part of your body, where you will always be feeling some pain, some cramp, some twisting of the muscles, some contraction of the muscles, which is beyond your capacity. And some of the scientists, they believe that there we can manage this dystonia condition, but there is no 100% cure for this, because it is genetic disorder. If we say genetic disorder, means gene is involved, and gene mutation, what the research paper publications are saying. So I have already given you in a very simple language, because it is very deep: chemistry, chemical engineering, protein chemistry, and then genetic material chemistry, that is DNA mutation. Mutation means the changes in DNA sequencing, and gene means it is the part of your DNA, genetic material. So in that genetic material, there are some proteins, they are known as cytosine, guanine, thymine, adenine. So these sequencing, once they are changed, that is called mutation, change in sequencing, and that can happen to any gene, to any body, to any animal, to any human being. So what in research publication they are mentioning, that three type of genes are involved in this condition of degenerative disorder, and the one is called that is your dystonia 1, dystonia 5, and dystonia 111 genes. So these dystonia DYT1, DYT5 and DYT111 genes, they are successful to identify these gene mutation changes, and that is causing dystonia to any part of the body. So I am showing some of the images. So this is the clear picture of basal ganglia just behind the frontal cortex of your brain, and there a lot of neuron cells, protein cells, they are responsible of your information passing to muscles and other places, and they are forming networking, cell neuron networking, and that networking is processing the message, and that message is going. So all the messaging center, we can say, tower, we can say, is basal ganglia place, which is very clear located here. And if there is some damage of such type of cells, those protein brain cells, then it may cause that type of degeneration, and that is affecting the whole body. This is chronic dystonia, that is facial dystonia on face. So the muscles, of the face, they contract, and after that contraction of the muscles, they are not returning to its original shape. That is the meaning of dystonia, distorted condition of your muscles, and muscles, because they are doing normal functioning of contraction, relaxation, movement, is on the basis of information they are getting from our basal ganglion, that center. It shows that center is disturbed in your brain, and that is the reason, that's why you are getting facial dystonia condition. This is the dystonia condition. Means your fingers and hand, they are not moving normally. There is no flexibility, and muscles, once they are contracted, there is no voluntary relaxation. Signals are not reaching here, and this condition is called the hand dystonia condition, where it is really crippled and you are in pain, and it is really very disturbing and painful also. A lot of discomfort is there in the life. This is very clear picture of posture dystonia. Posture dystonia means once it happen in your neck, cerebral neck, that cerebral column you can see, and then your head will be little bit tilted to other side. It will not be normal erect. That is very serious condition, and it will be always in a very critical condition. You cannot have the straight neck, and this dystonia condition is known as neck dystonia condition, where your neck will not be in erect normal condition. So here I have summarized lot of papers, latest publications, and it is written here so that the students who are in PG or undergraduate in medicinal chemistry and biochemistry, they can have this privilege of copying down. So here, number one, dystonia condition we can manage, but health condition cannot be fully cured. Only we can manage with all the new emerging technologies, but so far there is no 100% cure. Still some research is going on, that is on genetic mutation, genetic change, and gene sequencing, that is DNA, is already in action, and it is involuntary muscle contraction that cause twisting movements of muscles, and dystonia may affect one or more part of our body, and sometimes in chronic condition your whole body can be affected by such type of muscle contraction, and that is serious condition, may affect the entire body. The condition may be mild or severe. Number two, although researchers have not yet concluded and sure what causes dystonia, it is thought to be related to a problem in the brain, and that portion of the brain is called basal ganglia, and I have already given you the picture. It is shown, and how in that portion of the brain the information is processed by our neuron cells, and if it is not reaching, it means some destruction is there, and that is causing the contraction and spasm of your muscles, neck, and that dystonia condition can go to any part of your body, and that is where brain processes the information, and that helps your muscle contract. Here the brain cells and nerves that contact your body's voluntary movements, and they are the ones which are controlling your voluntary movements of your body, and they can approve or reject. So that is just like recharge card. When we are paying money, we are looking whether it is rejected or approved. Once it is approved, your contraction of the muscles will be normal. But what is not, which is rejected, the information which is processed in basal ganglia, then your muscles will be in the form of twisted shape. That is the problem. So once it is not approved, and the signal that is your brain sends is not reaching there. Number 3, some recent research publications indicating the mutation of the genes. So they have mentioned that actually this dystonia condition, health condition, is nothing but mutation of the gene. And I have already told you that our civilization of millions of years are changing is because of the mutation of our gene. Only then new type of species, variations, new variants are possible. And sometimes that mutation of the gene is positive and sometimes negative. So here it is negative, and those genes, that part of your DNA, genetic material, they have mentioned that they are DYT1, DYT5 and DYT111 are responsible of mutation of gene, and this genetic mutation is causing dystonia. But still their research in gene therapy is not yet concluded. Extensive research work is going on. So number 4, causes. What are the causes of dystonia? Number 1, that is genetic mutation, as per this latest research paper. Second, brain injury. If anybody who has gone through brain injury, maybe that person is injured and where lot of cells are damaged and it is not recovered. Then third is neurodegenerative disorder. I mean, that protein is not properly synthesized. That is called neurodegenerative disorder, is also one of the factor. Then number 4, infections. It has been found that those who are infected with meningitis, they got this dystonia health condition. So meningitis is very serious health condition or infection. Then number 5, toxins. The publications are indicating that if you are exposed excessively to carbon monoxide, manganese, that is Mn, and some other heavy metals. Number 6, hormonal disbalance. This hormonal disbalance, mostly it is found in during pregnancy of the female, where they get this condition, because during pregnancy mostly the testosterone and progesterone, means female hormone, if they are excess in production, and some other thyroid glands, then there is chance of getting dystonia health condition, and then that is also called thyroid disorder. Number 5, symptoms of dystonia. What are the symptoms? How you can say that we are on the road of dystonia. So number one symptom is sudden muscles contraction. Sudden means once your finger has gone like this and then it's very difficult to bring it to its normal condition, it is contracted. That is the first indication. And the second is tremors. It started slowly. I mean, you will feel that even if you are sitting then you're shaking, or sometimes it is trembling. So that is also one of the symptom. And third is muscle spasm. All of a sudden you will feel muscle spasm, pain, and usually it occurs during night. It's very common. The muscle spasm, and that is painful, can occur at any time. Number four, abnormal posture. All of a sudden your neck is erect, you are straight, but slowly one side you are tilted, your movement is abnormal. That is also one condition of dystonia. And then number five is pain and fatigue feeling. Always will be having some pain and fatigue feeling. I have already delivered one lecture on fatigue feeling at workplace. So these are all symptoms of dystonia. So here some points are given, some tips about the treatment of dystonia condition. Number one, botulinum toxin injection is very popular injection nowadays to treat dystonia. Here the injection botulinum toxin is injected into the muscles for relaxation. Number two, medication. We are using two type of medicine. One is called the benzodiazepine and dopamine agonistis. So benzodiazepine is very popular muscle relaxation, and also dopamine agonists to relax muscles. These two are used only for the relaxation of the muscles which are contracted. Then number three is deep brain stimulation. That technique is also used, and where implanting of the electrode, so it can activate the motor cells in the brain to stimulate the motor cells. That is called deep brain stimulation technique. Number four is physiotherapy. Expert physiotherapists can do selective massaging or some exercise so that that area is activated and the signals are received. Then fifth is finally, once it is chronic condition, we have to undergo surgery, and that in chronic condition surgery may be necessary to relieve the compressed nerve cells, where one sometimes when it is compressed by some other abnormal cells, and that is restricting or prohibiting the information signal to reach to muscles. That is also one condition. So if you remove all those, but of course it's a very very we can say complicated surgery, neurosurgery, to clear, because if any little mistake is committed, any part of your body can be 100% paralyzed. So that is also one condition where the damaged brain cells are there, that can be removed. So that is the last option, that is surgery. There are some home therapies we can use, and that is massage therapy, acupuncture, Chinese therapy. Then three, lifestyle change. I have already told you lifestyle change means you be disciplined and change your food habits and go to such type of diet which are rich in anti-inflammatory and antioxidant compounds, and then regular exercise, stress management. Actually, when I am saying stress management, it has broad meaning because everybody is under stress of any type, financial, family, and social, political, so many type of. So please, you train yourself to keep away from such type of stress. And my personal practice to manage the stress, I used to do two things. First thing, keep expectations zero from others. You do all the good things to everybody, but from others, you should not expect. You should not expect that they will reciprocate in the same manner. No, just zero. You do your good work, forget it. That is the best way to reduce the stress management. Secondly, your expectation, your skill, your education, and then your demand, that gap should not be too much. That I am holding the MS degree, surgery, neurology, or medicinal chemistry, I am holding doctorate and I am having 100 publications, I should be director, general, whatever. No. Just reduce that gap, do your work, be relaxed. Then that is the real stress management. The more expectation, the more stress. And of course, that is also part of, that is called greed. Greed of trying everything, grabbing everything, political power, financial power, money, everything, that it should come to me alone. And rest the whole world should die. That is very chronic condition of stress. So that if you can modify, you can reduce. Best, don't expect anything from anybody after doing good. Then 6 is your sleep schedule. I have already discussed a lot. Sleep is one of the very, very important factor for your brain health, and I used to call it just like battery. Whole day, if you are working for 10 hours, and once you sleep means you have put your hardware battery on recharging. So once you will get up, you are with full charge battery to work for 8 hours. So your sleep schedule should not be disturbed. So with this, I will stop. Thank you very much for watching the lecture.